Domestic violence cases in Singapore were up in 2024, driven by a rise in child and spousal abuse. Within these, the number of new high-risk child abuse reports climbed by about 14%, with primary school-aged children forming the largest group. In its annual report, the Social and Family Development Ministry says greater awareness and more willingness to report have contributed to the rise. Chloe Teo breaks down the numbers.
Behind every statistic is someone living with violence at home. These aren't just numbers, they are families in crisis. To understand what's happening, we first have to see how the authorities classify these cases. Cases reported to the ministry fall into two tiers. Tier 1 covers lower risk cases. For example, verbal abuse that doesn't escalate into physical violence, or milder emotional abuse. These are usually handled by community agencies. Tier 2 is where victim safety becomes a real concern, and authorities can step in, including removing someone from their home. These cases can involve severe physical injuries or sexual abuse. The number of lower-risk child abuse cases rose again in 2024, continuing an upward trend since 2021. Boys aged 7 to 12 made up the largest group, broadly similar to the pattern we saw in 2023. High-risk or Tier 2 child abuse cases had been falling from 2021 to 2023, but in 2024 there was a sharp jump in reports. Physical abuse was the primary form. And like the lower-risk cases, most victims were primary school-aged children. The ministry says this may partly reflect schools being more vigilant in spotting warning signs and reporting them. Spousal abuse cases are also on the rise, but authorities point out that most of these are self-referrals, suggesting more victims are willing to seek help and know where to go for support. As Singapore becomes a super-aged society, more seniors are showing up in Tier 1 abuse data, facing situations that put their safety at risk. The good news is that severity is not escalating. MSF says early intervention by social service and healthcare agencies are helping families address problems before they worsen.
Preliminary data for 2025 also showed an uptick of new Tier 2 child abuse cases in October compared to earlier months this year. MSF says it observed this increase in the weeks after the release of an independent review panel's report on Megan Kong's fatal abuse. New Tier 1 and 2 child abuse cases in the first half of the year were lower compared to the same period last year. However, new spousal and elder abuse cases were higher in the first half of this year. MSF says more cases are expected to surface in line with ongoing improvements in detection and reporting before stabilizing over the longer term. Now, agencies in Singapore's protection ecosystem say rising domestic violence could be a reflection of growing external pressures. These include economic strain, which causes severe stresses on the home front. The agencies caution that without stronger support and resilience, families risk falling into generational cycles of abuse. Chloe Teo again reports.
When going home could mean danger, even death, where can you turn to? For some victims of abuse, a crisis shelter is a last resort before violence escalates fatally.
Close to 90% are women who face violence, spousal abuse, and also there are women who are in relationships and face they are not married and face intimate partner abuse. We've noticed that from the cases we see in the shelter, many of the male abusers are struggling with addiction issues and also some underlying mental health challenges.
She adds that these intersecting issues often impair emotional regulation and contribute to patterns of abuse. Another centre notes that as the nuclear family evolves, so do the risk factors it encounters.
Families are getting a bit smaller. There could be also higher economic strains, and these could be contributing factors to how things have evolved in the areas of how families cope with stress. They could also be spending less time together. They could be working longer hours, spending lesser time with their children, or they could be having a hard day at work and they can't really release their stress. And in turn, they vent their frustration on their spouse or even their children.
But the effects of spousal abuse often extend far beyond the immediate victim. In homes where violence happens in the shadows, children may not be victims themselves, but witnessing these acts is itself a form of abuse. And this could be how intergenerational cycles are formed.
In cases where the children witness violence, this also has a very long-term effect on them, because they might also normalize violence and think that violence is a way to cope with stress, is a way to solve problems and conflicts.
Agencies say breaking these cycles of violence will require a whole of community effort. It's a message the Social and Family Development Ministry has been working on. It says it has already seen growing interest from a diversity of sectors and organizations looking to play their role in prevention.
We have a standard set of content that we deliver, but each training has to be tailored to fit the specific needs of the organization. And it covers three main areas. The first one is a definition of what domestic violence is and its context within Singapore. Second is training the participants how to recognize the signs and symptoms of abuse. And the third, which is very important, is a discussion on what are some practical steps they can take, right, if they suspect or detect.
Interested parties can find more information on MSF's Break the Silence website.
And to break down what these numbers on domestic violence mean, we speak to Dr. Shawn Ee, who is a clinical psychologist from the psychology practice, and he joins us now on Zoom. Dr. Ee, welcome to the show. Now, the report says we're seeing more cases of domestic violence reported because people are more aware and also professionals are better trained. But could there be other underlying reasons behind this rise?
Certainly, we firstly need to recognize, right, that there's, of course, better reporting now, and a higher professional level of training play a huge part. So therefore, more cases are being seen rather than hidden. But also a genuine rise, right, may also reflect, as reported earlier, greater family stresses like financial strain, work pressures, thinner support systems. We also think that parenting norms are shifting faster than coping skills, and emotional regulation is a growing challenge across generations. So another point is that we think about increased digital exposure also means that children's distress is more visible and sometimes intensified.
No, and we're also seeing a rise in low-risk cases involving children between 7 to 12, and with boys making up a large group. What does that tell us then about what children in this age group are facing today, whether it's at home or even in school?
I mean, we know boys and girls are quite different developmentally, but in general, the age range represents a group that is at a developmental crossroads, where they are still dependent, but yet increasingly aware of conflict and pressure around them. We all learn from people around us. We can't help it. So there are things like academic expectations, performance anxiety, social comparisons, including online environments, right? That all these heighten vulnerability. And of course, at home, any kind of unresolved adult stress may spill over emotionally or physically onto children. Okay, we may start seeing kids, right, breaking down earlier rather than only in adolescence as traditionally expected.
Now, with the year-end holidays coming up as well, are these breaks usually a more vulnerable time for children in troubled homes? Or what can the rest of us do when it comes to keeping these children safe, especially during this period?
I think we must first recognize, right, that the school holidays also remove a key safety buffer, which is actually teachers and peers who might notice concerns. So again, more time at home can mean longer exposure to conflict or neglect without interruption. So the public can help by staying attentive, check in on families, don't ignore signs of distress, and try to report concerns earlier if possible. Community spaces, for example, and programs offering safe activities can be a lifeline for vulnerable children if they are aware as well.
Now, Dr. Ee, we heard earlier that the reports of spousal abuse, that's also up. And it's mentioned that these are mostly self-referrals, especially due to greater awareness. Now, this is quite encouraging because it shows that more women are speaking up. But does this also indicate that education and campaigns that have worked and that more can actually be done?
Yeah, certainly. I mean, if we think about it, chronic exposure changes how the brain wires us for trust, safety, and emotional regulation. Well, kids may learn that love comes with fear or that harm is normal. It's not shaping our future relationships. So it can lead to hypervigilance, withdrawal, aggression, or difficulties with concentration and learning. So what we can do is, early intervention. Okay, it builds community awareness. We can take action earlier, rebuilding safety, restoring attachment, and reduce lifelong consequences like our subsequent learned relationship patterns.
Now, in these cases of spousal abuse, we know that most of the aggressors are men with addiction issues or any underlying mental health challenges. What more can be done to reach out to this group, not just the victims, but also the aggressors themselves, to provide more help?
I think in a general way, the way in which we approach practice would be to create awareness. And sometimes the way forward is not to go with judgment and a critical kind of view. It might be about helping them understand what affected them in the first place that might underlie their behaviors. So that might be a more gentler, more welcoming approach to individuals that might be the offenders.
Let's turn now to the elderly. We know that Tier 1 elder abuse cases, that's going up. So why should we be worried about this rise, even if all these cases are considered quite low risk?
So, according to the definition, right, Tier 1 doesn't mean not harmful. It often reflects early warning signs of stress, neglect, or poor coping. So if we ignore, then these cases can actually escalate into more severe harm over time, as we would see with many examples of offenders getting more and more and more. So they signal pressure on caregivers and gaps in emotional or practical support for families. So action at Tier 1 is prevention, and we know that the best chance to stop further deterioration is here.
Now, before we go, Dr. Ee, what more can each of us do in our own capacities to prevent abuse in general and to look out for people who might be in these situations?
I think in general, again, the point is about being able to be observant for people around us, especially knowing that there might be some elderly in our families or someone else, neighbors as well. So we want to try to be as aware and try to, check in with people. That generally is a more gentle way of approaching. And, in general, if we hear like loud noises, we hear like a lot of shouting and stuff like that, we don't want to be busybodies, but we just want to keep an eye out in case someone might, require a bit more help. And if that's the case, then we may, gently rock up and try to be respectful, but also show some support by offering something along the way.
Dr. Ee, thank you so much for sharing your insights with us. I've been chatting with Dr. Shawn Ee, there from the psychology practice.